Good morning, everyone. Today I'll be speaking on the case series of Igg4 related orbital disease clinical pathological spectrum. The Igg4 related disease is a systemic inflammatory condition characterized by tumor-affective lesions and infiltration of tissues with Igg4 positive plasma cells. It has a broad range of clinical presentation that can involve nearly every organ in the body. Coming on to the ophthalmic manifestation, it can involve many structures of the orbit, most common being the lacrimal gland. It can affect, usually it affects the middle to the older age group in the 5th to the 6th decade of life. The children may also be affected in this Igg4-RD. There's no difference in the sex predisposition, but some studies show slight male preponderance. Usually we follow the diagnostic criteria for Igg4 related ophthalmic disease given by Goto et al. In 2014, which shows us the radiological features, serological features, and the pathological features, based on which we diagnose it as a definite, probable, and a possible Igg4 ROD. The objective of my study is to describe the clinico-demographic profile of Igg4 ROD diagnosed at a tertiary care center in India during a 4-year period. It was conducted in Dr. R.P. Center for Ophthalmic Sciences, AIMS, New Delhi, during a period of 2021 to 2024. It was an ambispecative observational study with a sample size of 19 patients. The patients who were compatible with the diagnostic criteria mentioned previously were included. So this was a retrospective arm and the prospective arm were included, and the patients were selected and the analysis was done. So based on the demographic, we can see that in the 19 patients that we have, there were 14 were adults and 5 were children. And in the adults, the median age group was 37 years, while in the children it was 12 years. There was more of a unilateral presentation in both the groups, both the adults as well as the children. And there was systemic involvement found in only one pediatric child, which on PET scan revealed the involvement of the cervical lymph nodes. So these are the various clinical presentations of the Igg4 ROD, where we can see that proptosis was the most common ocular presentation in both adults and the children, which was followed by other presentations like the eyelid swelling, diminution of vision, uveitis, or ptosis. Now coming on to the radiological findings, here the lacrimal gland was the most common orbital structure involved in both the adults as well as children. Here we can see that in the first diagram, there's the bulky lacrimal gland which is involved. In the second diagram, there's an involvement of the infraorbital nerve thickening. And then in the third diagram, we can see the extraocular muscles involvement and thickening. In the fourth diagram, we can see that along with the extraocular muscle thickening, there is a pachymeningeal enhancement. This pachymeningeal enhancement has recently been included into the revised diagnostic criteria, which is a cause of optic neuropathy. So this slide shows the microphotograph showing the dense lymphoplasmacytic infiltration that we see in Igg4 ROD. And in the next picture, we can see the Igg4 positive immunohistochemistry slides. Based on all these features, we divide the patients into definite, probable, and possible in both the adults and the children. Now I'll be talking about two case presentation. Case one, it's a 35-year-old gentleman with a proptosis with serum Igg4 within normal limit and MRI with the lacrimal gland and the recti muscles involvement. And the biopsies show the positive Igg4 stain with a lymphoplasmacytic infiltrate, giving a diagnosis of probable Igg4 ROD. This is a second case, 45-year-old female with proptosis with a high serum Igg4 level and bulky extraocular muscles and a positive biopsy findings. So it is a definite Igg4 ROD. Now coming on to the discussion, the average age of diagnosis of our series was 37 years for the adult population. This was much less than the other studies by the Goto et al. At 2021, which was 60, and Mule et al. It was 51 years. And in all the three series, we can see that the lacrimal gland was the most commonly involved structure. In our structure, what was different again is that we have more of a unilateral presentation than the bilateral, in contrast to the Mule et al. Study. So, but in other studies, which is related to the systemic Igg4 studies, the age of presentation is similar to our series. Now, these systemic manifestations are usually strongly related to the bilateral presentation and lacrimal gland involvement. In our series, only one patient was involved. It was because of the mainly unilateral ocular disease and a shorter follow-up period. So, a systemic identification of a metachronous organ involvement requires regular and longer follow-up period. And it is also important to note that the elevated serum Igg4s are not always suggestive or specific for Igg4 ROD. And to conclude, Igg4 is a matter of disguise, master of disguise. It can present variably, making diagnostic challenges for the clinicians. This series highlights lower age of presentation, more number of unilateral presentation, and lesser systemic involvement. So regular follow-up is required to identify any metachronous systemic involvement. Catch the disease early and follow it for life are crucial mantras to prevent complications. Thank you, ma'am.
Thank you, Dr. Angku.
Yes.
So, did you biopsy all the patients, or it was just a clinical diagnosis?
Sorry, ma'am?
Did you biopsy in these
Yeah,
patients?
we did the biopsy also, the retrospective plus the prospective ones. So in the retrospective, we went through the biopsy reports that was given. And all the serum Igg4 were also done.
So, all the cases were biopsy proven
Yes.
Igg4
Yes,
disease.
ma'am, yeah.
Okay.
And did you do a PET scan for all the cases? Or?
Ma'am, yes, PET scan was done usually at presentation when we are suspecting Igg4, we are doing it
For
now.
all the cases you did?
Ma'am, in previous, the one with the retrospective one, not for every patient we did the PET scan, but now in the prospective one, we had done for all the patients the PET scan.
Yeah, how was it helpful?
Yeah, what were your findings?
Ma'am, actually in PET scan, only one of the systemic involvement was there, because this PET scan helps in understanding the overall disease systemically, how much is it involved, because the patient is presenting us with only the orbital complaints. So if we can identify any systemic involvement and then treat it accordingly, because if these are not treated, then it can lead into deadly pancreatic disease, which can later lead on to death if it's not identified early. So
how did you manage them?
Ma'am, for the systemic involvement, ma'am, in our patient, only one was involved, which had a cervical lymph node positive. So we had started those patients with the steroid, then later on with the immunomodulators were added for the patient.
Which immunomodulator you use?
Sorry, sir? So we usually start with the mycophenolate mofetil. And then based on the patient's response, if the patient is maintaining the response, then we'll be continuing it. But if it's not responding, maybe we'll go into higher drugs like azathioprine or a rituximab kind of thing. But initially with steroid, then MMF it depends on the clinical response.
Have you noted the relapse?
Sir, actually, the study is still ongoing for the prospective arm. We are still doing it, and where we are doing the treatment analysis also. So we'll be commenting upon that in a later half of
Okay, thank you.